Good morning, everyone. This is the Ophthalmology Business Podcast, where we help you develop your ideal practice with help of other doctors and experts. The topics we cover include marketing, management, leadership, recruitment, HR, mindsets, and more. I am Naren Arulraja, the founder and one of the co-hosts of this podcast. Every listener of this podcast is welcome to join the Ophthalmology Business Academy, www.obacademy.org. The membership is on us, and it's a gift to you. Today, I'm excited to talk to Dr. Rudrani Banik, a board-certified integrative ophthalmologist and fellowship-trained neuro-ophthalmologist. You might find her as Dr. Rani on social media. She's the founder and CEO of Envision Health, NYC. She's a visionary in the field of ophthalmology who combines traditional medical and surgical methods with holistic approaches, integrating nutrition, botanicals, supplements, lifestyle modifications, and natural therapies for comprehensive eye care. Our topic today is integrating holistic approaches into ophthalmology practice, a strategic perspective for doctors. Before we jump in, Dr. Banik, why don't you take a minute to tell us a bit about yourself? Who are you? How did you get into ophthalmology? Tell us your story and perhaps take us all the way to, you graduating from university with a degree to where you are today.
Well, absolutely. First of all, thank you so much for inviting me to your podcast. I'm really excited to be here and share some of my experiences and knowledge with your audience. So going back to medical school, I was really debating between two fields, ophthalmology and neurology. And I loved both, but I ended up choosing ophthalmology because of the technical aspect, the surgical hands-on aspect. And I loved the thought of being able to restore someone's vision with a sight-saving surgery. So I trained in ophthalmology, but then when it came time to decide on fellowship, neurology really drew me back. So I ended up doing a fellowship in neuro-ophthalmology. So subsequent to that, I had several positions which were all academic based. So I was on full-time faculty, first at Albert Einstein College of Medicine in New York. And then I became a residency program director at another ophthalmology program. And then I got recruited to go to New York Eye and Ear Infirmary of Mount Sinai to not only join their faculty, but also to run their clinical trials. So at this point, I was thinking this would be my career to stay in academic medicine. But then, there were some twists and turns that came along the way. And I was introduced to the fields of integrative and functional medicine. Now, as a traditionally trained doctor, I'd never even heard of these fields before. I don't know if you have, but I didn't really know what they were. So I really started to learn more about them. And it really fascinated me, the concept of treating someone, as you said, holistically, not just focusing on one organ, whether it be their eye or their heart or their lungs, their skin, whatever one specialty may be, but really to think about the body holistically, to think about different systems and how they're balanced and how we can promote overall health. So what ended up happening was I decided to get certified in integrative and functional medicine. So this path took me several years. It took me about 5 years to complete all the coursework and to take the exam and to get certified. But that's really my path into what I do now, because I really do think I blend two fields together or two approaches to health together. And that allows me to provide the level of care that I do for my patients. So in a nutshell, that's kind of how I ended up doing what I do.
Oh, that's awesome. Today's topic is integrating holistic approaches into ophthalmology practice, a strategic perspective for doctors. Let me jump right in. Let me ask you the first question I have for you. How do you integrate traditional medical and surgical approaches with holistic methods to optimize eye health outcomes?
Well, first of all, the medical history is key, not just the eye history, the medical history, what's going on, and then also what's going on in their other aspects of life, their psychosocial aspects, because as we know, stress is a major player in many chronic diseases. So first, I try to get a sense of what's going on again, medically. And then I delve really deep into their eye history. And as a neuro-ophthalmologist, I do see patients with very complex eye histories, and sometimes neurologic diseases as well. For example, multiple sclerosis, autoimmune conditions, myasthenia gravis. So I do think that putting their eye health in the context, a larger context of their overall health and wellness, again, their physical health, but also taking into account their stressors. So we also have to address their mental health as well as their spiritual health. I think that really provides the full framework for addressing their eye issues. Now, in my training as an integrative and functional medicine provider, I also try to connect things back to the immune system and to gut health, because in the world of functional medicine, gut health is really the key to helping to solve a lot of issues. So I look for things like, could there be some inflammatory component linked to maybe gut dysbiosis? We're all learning about the gut microbiome these days and how important the microbiome is. So I try to do some investigations there. I try to look at their hormones. Could, some hormonal imbalance be perhaps triggering some of their eye issues? For example, dry eye is a major, player here in terms of hormonal balances and dry eye issues and inflammation. So I try to delve a little bit deeper. And sometimes I do additional tests that most regular physicians don't order. These are not standard tests. These are more functional medicine type tests, again, to look at their gut health, to look at their hormones, to look at their levels of inflammation in the body. And so that's kind of how I bring it all together. One thing I will say is to do this, to provide this type of care requires quite a bit of time. And I think that's really the key here, is that it cannot be done in a regular appointment, a 10 to 15 minute appointment. It simply cannot be done. And oftentimes when I see these patients who are coming to me for this type of approach, I have to spend about 1 to 2 hours with each patient. So that leads me to the other aspect of what I wanted to share with you and your audience is, how do you make this work financially? Because you cannot do this within, seeing a full day of patients, the usual, however many patients you normally see in a day. Some people just see 20 to 30 patients, other people see 60 to 80, or perhaps even more patients a day. It's simply not possible to provide this type of care in that type of practice setting. So what I ended up doing was, when I decided to go this route to provide a holistic integrative approach, number one, I left academic medicine. That's the first thing I did. So I left my full-time position to open up a private practice. I still have my title and I still teach, but that's more of a smaller aspect of what I do. And in opening up my own practice, I was also able to determine my model, which for now is a cash-based model. And so that's how it works, because I would not be able to do this within an insurance model, getting paid per visit, whatever the insurers normally pay. It would not work. So that's how it's feasible.
Makes sense. Before we jump in, I had a kind of a quick question. I know a lot of people are, everyone listening most people who are going to be listening to this are ophthalmologists who are, doctors. They all love evidences. So actually, does it make a difference in your experience? Can you share maybe a story or two of actual patients where your integrative holistic approach, made more difference than, let's say, the traditional, see a patient in 15-minute approach?
Yes, absolutely. So as a neuro-ophthalmologist, I deal oftentimes with NAION, which is non-arteritic anterior ischemic optic neuropathy. And we traditionally think, okay, these patients typically have risk factors. They may have a small cup to disc ratio, but they also probably have some systemic risk factors like high blood pressure, diabetes, sleep apnea. That's a major one that we oftentimes ask about. So I had a patient who came in initially with longstanding decreased vision in one eye due to amblyopia, and then he had NAION in his good eye. So he was really devastated. He was still working, unable to basically read, do his normal activities, drive, etc. So he was very motivated to do whatever it would take to perhaps, stabilize his vision, but just to have a better approach to overall health, because he didn't want to have a repeat episode in the same eye. And he certainly didn't want to have an episode in the other eye, which was now his better eye. So his worst eye became his better eye. So he was very motivated. I put him on what I consider a therapeutic diet. And so this is not, like a fad diet. It's not like, we oftentimes hear about intermittent fasting or a keto diet or that type of diet. This is a diet that really gets to some of the what we consider root causes of what's going on. So, for example, this patient had metabolic syndrome, and so I put him on what we call a cardiometabolic diet to improve his metabolic syndrome. And he was so motivated. And this is the type of patient you obviously would love to work with, somebody who listens to your recommendations and really wants to do everything possible to better their health. So he ended up following this diet for about at least 3 months, but he's still continuing it in a slightly lesser degree. He was able to lose 30 pounds. He was able to get off of his blood pressure medications. He was borderline diabetic. So now his hemoglobin A1C is within normal range. He was able to come off cholesterol medications. And also he did used to have to use a CPAP machine. And because he lost all the weight, he was overall metabolically much better. He was able to stop using his CPAP machine. And this is all with changes in diet, but also, of course, I did talk to him about lifestyle modifications, solely incorporating an exercise regimen into his daily life. And then I also use some botanicals, which I use in patients with NAION. And this is based off of some evidence in certain botanical agents that have been around for millennia that have been used for other conditions, but now I use them for eye conditions as well. So this is an example of how if you take a patient who has an eye issue, that is a chronic eye issue that typically cannot be reversed, you can still improve so many other aspects of their health and improve their optimal eye health outcome by, optimizing a lot of their risk factors.
Right. So in this particular example, it's amazing. What was the impact from an eye health standpoint? Did the issue kind of reverse itself? The issue that he
as we know, NAION
right.
is, there's only so much improvement you can get. We typically say about 40% of patients may improve slightly, but they're never going to go back to baseline. Mm-hmm. So he did improve. He actually improved by 2 lines. And whether that was natural improvement or because of some of the interventions that we had, implemented, I'm not sure, because it's not a clinical study. This is right. A anecdotal, a story. But I think the key was, he improved some of the other aspects of his health, but also he felt as though he was doing everything he possibly could to be proactive and protect his good eye. Right. I think that is such an important concept in terms of patients when they are so fearful. Let's say they've already had an event happen in one eye, whether it's, something like this, or let's say they have diabetic retinopathy or whatever else it is that, that's affected them. They're so fearful of what could happen. And this allows them to take charge of their health and somehow have some, autonomy in maybe dictating their ultimate health outcome. So I think it is very empowering to patients to be able to do this. And again, it takes somebody who's motivated. Not everybody will be so motivated, but if you work with the right types of patients, they can really achieve really amazing health outcomes.
With your approach, could you have prevented this? Had he come to you a long time ago, for example, or not really?
I wish. I wish patients were aware of these, these types of approaches. And this diet that I put him on, it wasn't a completely restrictive diet. It was something very doable, making small changes, but these small changes can have really incremental benefits. And so I really wish that more patients, were proactive about their health and their eye health by thinking, okay, what am I eating? What could I be doing to really fortify my vision? For example, macular degeneration is another perfect example. Even as a neuro-ophthalmologist, I do deal with a lot of patients with macular degeneration who come to me for an integrative approach. Perhaps they have wet macular degeneration, they're getting injections of anti-VEGF agents, and they want to do anything else they possibly can. So I put them on a specific type of diet that I've developed called a macular degeneration diet. And it really fosters, a lot of foods that are rich in those macular carotenoids, but also other anti-inflammatory nutrients. I talked to them about the research that's been done on exercise and macular degeneration. I put them on an exercise regimen. I talked to them about UV protection, basic things that a lot of doctors, we don't know about these things, but we don't necessarily have the time to spend with our patients to get down into the nitty-gritty and explain it. And maybe you're fortunate, maybe in your practice, you have a healthcare coach or you have a nutritionist who can take the time and work with the patients. But I think to really provide a holistic approach, the time has to be there. Patients have to be given that opportunity to learn and to ask those questions.
That's amazing. What are some of the strategic advantages of ophthalmologists incorporating these holistic approaches, such as nutrition, botanicals, lifestyle modifications, based on your experience?
Well, first of all, I think there's this patient satisfaction. I think patients really feel like they're so well supported and well taken care of. But also from a physician's perspective, I feel like I'm not just taking care of their eyes, I'm taking care of their entire health. And to really see people improve in these amazing ways is very gratifying.
Mm-hmm.
And I'm sold because I myself, I didn't mention this earlier about how I came upon integrative and functional medicine, but I had my own health issues and I was suffering with chronic migraines at the time and nothing was making it better. So I was able to really turn my own health around using some of these principles and strategies. So when I share my own experiences with my patients, they feel like, okay, here's a doctor who's been through it herself. She knows how impactful some of these changes can be. And I also want to try to achieve this type of, natural type of improvement in my health. So it's gratifying both from the patient's perspective as well as the physician's perspective. Now, what I can tell you from a business perspective is that this is really a niche type of practice that I've developed. And, if you want to really stand out in your area and wherever you're practicing, and you want to offer something unique, beyond a standard ophthalmology practice, beyond whatever your specialty may be, whether you specialize in cataracts or glaucoma or retina, I would strongly advise considering getting. You don't necessarily have to be trained yourself, but getting other staff members like a health coach to work with your patients, and you could charge them extra for that. This could be an add-on. Out-of-pocket expense. You could get a nutritionist to work with you. There are so many ways by which you can offer these types of services. And I also think that now, in you could say, I guess, post-pandemic era, a lot of people they want to be proactive about their health. Health has really been brought to the forefront in the past 3 years, and people are turning to things like supplements and diets and other modalities for healthcare. So people are trying to seek this out for their general health, but also for their eye health. And if you're able to offer this type of service, it's really a niche service, you can really provide a lot of value to your patients.
Let me ask you a question. So let's say I'm an ophthalmologist and I'm listening to this podcast and I'm sold. I want to kind of go down your path. Where can I go and educate myself? Where can I go and, kind of really understand, much more detailed level what functional medicine is and, all those things you kind of started touching on. So hopefully I can, again, it may not be like overnight I'm going to be you, but hopefully I can go on that journey. You know what I'm saying?
Yeah. So there are, I would say, 4 organizations that are within the U.S. and they also have international members as well that offer this type of training. I would say what many people, or most U.S. trained doctors or MDs tend to do is the College of Lifestyle Medicine, and that's a recognized organization. There is a board exam that goes along with it. So I believe it's recognized with the American Board of Medical Specialties. And so that's a relatively short program. I think it's about 6 months long. And you do the coursework. I think most of it is virtual. There may be some in-person conferences. And then you have to take an exam. And that will teach you the basics of lifestyle medicine. And that does include nutrition as well. If you want to take a deeper dive, there are 2 functional medicine organizations. One is the one I trained with called Institute for Functional Medicine, IFM. And this is probably the largest functional medicine organization in the world. It has thousands and thousands of members, not just MDs, but also other health practitioners. There are nurse practitioners, chiropractors, nutritionists. There's all kinds of specialties within IFM. And this is the course that I took. And it took me, again, 5 years to complete. I was also working at the time. So, trying to balance my practice, but also doing the coursework. I think the earliest you could probably finish it would be within 3 years, but it's very rigorous. It's very, very rigorous. A lot of modules, a lot of training. Then there's Functional Medicine University, which also offers coursework and certification. I don't know exactly how long it takes, but I would think it's probably at least 2 or 3 years. And finally, there's A4M, which is, I hope I remember this properly, American Academy of Anti-Aging. So A4As and A4M. And so they offer coursework as well, more in the anti-aging realm. So a lot of other, modalities, some of them are supplements, botanicals, other types of interventional procedures that are geared towards anti-aging. So again, there's 4 different ways to approach this. And I would say first, if you're interested, I would suggest that you kind of do a little bit of research and find out which path you want to take and consider getting certified.
Makes sense. Thank you for that. Are there any specific marketing strategies or patient education initiatives that can be implemented to differentiate a practice? Let's say I want to go down this road, but I want to stand out. I want to tell my story, who I am, how am I doing things differently. So what can I do from an education/marketing perspective?
Well, I think there's 2 components to this. First is your website. So your website has to reflect what you're doing. And, if you have your own personal story, personal journey, patient stories, share all of that on your website. And video is gold. It really is in this day and age. So have videos on there. And the next thing is, when I started up my practice, I tried many different things. Initially, what I tried was I actually went door to door. And I went door to door to my fellow ophthalmologists in the area, to primary care doctors. What I'll tell you is it did not work. Going door to door and making yourself, known in your community amongst your peers, it was very labor intensive, and it really, unfortunately, did not really bring many benefits. So what I decided to do was I decided to go directly to the consumer. And I started to do some Google ad campaigns, which got me off the ground. That was great. Then I really started to do social media. And I think that's where it comes, that's where people find you. And initially I thought with the social media, I started to do Facebook, some YouTube, Instagram. And initially I thought, okay, it's going to be mainly the younger generation that's going to find me via social media. But actually that's not the case. What I found is that the entire spectrum, of all ages actually found me through, many patients found me through social media. So, sometimes I would get patients who were 70, 80, 90 years old come in, for an integrative approach. And I would ask them, how did you find me? And they would say, oh, I saw your YouTube video, or I saw your Instagram. And I was pleasantly surprised that these patients whom you would think, perhaps they're not so engaged on social media, they're the ones who are finding me via social media. So I think there are many avenues you can take. But I think getting out there, getting your face out there, getting your message out there, that's also very important. And I'll just share just a little something, a project that I've been working on. So to really educate more people about this type of approach to eye health, I wrote a book, which is Beyond Carrots. And this just came out 2 months ago. So it's all about food. And it's all about the nutrients and the foods we need to keep our eyes healthy. So, I also, to spread my message beyond just my patients, I want to create educational programs for both patients, but also for my colleagues, to educate my colleagues in ophthalmology and optometry. Okay, this is how you should be counseling your patients about nutrition, really to go into a deep dive. These are the foods that can help fight macular degeneration. This is what you can do for dry eye. This is what you can do potentially for glaucoma. And so if we educate ourselves first, then we can better serve our patients in this way.
You are an exciting and interesting person. So, thank you for doing what you're doing and what you're sharing. We work with doctors, as you know, we do marketing. And in dental, for example, we have 40 doctors who are holistic dentists. So exactly what you're talking about, the overall health, paying attention to the whole patient as opposed to just the mouth, or in your case, just the eyes. So I think and like you said, those trends are accelerating where patients want to take care of their health. They want to have this holistic perspective, and it's not it has, I think it started before COVID, but COVID really pushed it, I think, over the edge. It's just like so many people don't want to go to the office anymore. Same way, so many people are not going to say, well, I'll let somebody else take care of my health. They're going to take care of their health. And if you as the physician can help them do that, you are part of their team for life, pretty much. And I think, like you said, a lot of these eye related issues come when you age, right? So like in a lot of these diseases, so there's a huge market, and these are the people with the time and the money and the resources to do these things. So they're committed, they're pleasure to work with. I see the benefit to you, the patient. Can we switch gears and talk about the benefit to you as the practice owner? So perhaps you can share your case study. Like, in other words, how did this impact you? I know you talked about satisfaction that you get personally being able to help people. Beyond satisfaction, like, can you share, like, how did it change your practice? Maybe profitability, maybe the time you work. I don't know what the metrics are. And perhaps if you have other examples beyond yours, go for it. But just to kind of understand, think of it like, let's start with the end in mind. We know what a typical practice looks like and what life looks like for that doctor. What does life look like for you, financially, all that stuff. So go ahead.
Yeah, absolutely. So, I was really nervous when I opened up my own practice. I did not know what would happen because basically I not only opened up a solo private practice, but I also decided to go cash-based. So I opted out of all insurances, including Medicare. And, I really had no idea how many of my patients would follow me. How would I get new patients? So it was really kind of, a new frontier. And what I learned over time is, the benefit of having my own practice is I can design it the way I want. I can see as many or as few patients a day as I want. I can work as much or as little as I want. So there are some months when I work a lot more. I'm in the office a lot more. And then there are some months, for example, when I was writing my book and now I'm doing marketing for my book, I actually scaled back my days in the office. And so being my own boss, basically a practice owner, I can decide my own schedule. And I think to be able to practice in this way where I am not told, okay, you have to be in the office for this many days and you have to see this many patients. To be able to be in control was just so freeing for me. Just mentally. I can pursue my creative interests. I can write. I can teach. I can do videos. And I think really it opened up so many new doors for me, being able to stay out of a traditional kind of a model. And I can't even imagine going back now to a full-time practice. So for example, right now, I'm only working part-time because, as I said, I just got the book off the ground. I'm doing marketing. I actually just launched a supplement line also. And so that's coming out later this month. So, getting everything in place for the supplement line, the manufacturer, the fulfillment center, the distribution, the marketing, that takes a lot of time. So, to be able to just balance all of that. And the good thing is, even though I have this part of what I do, I still work in the academic setting. So I teach 1 day a week. That's my set day. I teach residents, I teach fellows, I teach medical students at Mount Sinai in New York, at New York Eye and Ear Infirmary. So I still have, kind of one, aspect of my career, entrenched in teaching and giving back to the community and doing some research. I do run some of the clinical trials in neuro-ophthalmology there. So, having that balance is really important. So yes, I have the entrepreneurial aspect of what I do and the patient care aspect of what I do in my private practice, but I also have the teaching aspect and the research aspect to give back to the community. And so, for example, if a patient calls and says, I really want to see you, Dr. Banik, but I can't pay out of pocket. I'm not able to see you privately. How can I see you? I say, well, come see me in the clinic. Come see me at the hospital, because at least there I can help guide your treatment. It's not the same level of care, but I can still see you and I can still help take care of you, participate in your care.
Right. That's excellent. Are there doctors, to your knowledge, who are practicing your way? Like how many? Or do you know others who are doing this? But maybe not necessarily like writing a book, maybe not necessarily teaching, but just like different type of care.
Yes, so there are many providers in other specialties. In terms of ophthalmology, I think there's probably only a handful of us, honestly. I think there's, I don't remember his name. There's a retina specialist in Florida who provides, some training and services in nutrition, et cetera. And then I think there may be somebody out in California. I'm not sure. So there aren't that many of us. But I think the need is there. And if you do your outreach and your marketing in the right way, you will find those patients. So I think, and then there are some optometrists who do it as well. Now, I just say that with a little bit of grain of salt, because there's a lot out there, as you know, with social media that, there has to be science behind what we do, and not everything is science-based. So again, some of the other providers out there who, at least the couple of people I'm thinking of who are optometrists, don't fully follow the science part of it, but they do provide a holistic, integrative approach to their patients as well.
Perfect. Before we wrap up, are there any final thoughts you want to leave our audience with? And also perhaps tell us how they can kind of follow you or, stay in touch, or maybe just see what you're up to.
Absolutely. So, one final thought is just be open to the possibility. When I finished my training and I started working in academic medicine as a neuro-ophthalmologist, I never would have dreamed that I would go out on my own, start my own practice, do some entrepreneurial things on the side. I never would have thought that, but doors opened up for me along the way, and I was receptive to that. So, you may think your career path is one way, but then you may get sidelined by something. So just be open to it and explore and see what's going to work for you. And I think you'll find that if you do that, opportunities will come about that you never would have expected. And, in terms of my social media, so I would love it if you could support me and follow me in the book, but also social media. So Instagram is perhaps my largest channel right now. And on Instagram, I'm at Dr.Rani Banik. I also do have several Facebook groups. One is on general eye health. It's called Envision Health. I also have a separate group on macular degeneration, which is called Macular Degeneration Diet and Lifestyle Tips. And then I have another one for migraine, which is Eye on Migraine. So I have different kind of channels that I have depending on what patients are looking for. But I invite, colleagues to join as well, to share their experiences and to learn. So so I'd love to connect. Please connect with me if you have any questions.
Thank you so much, Dr. Banik. I learned a lot, and I think you're an inspiration. I'm an entrepreneur, so I love what you're doing, and I have, a lot of respect for what you're doing. If you enjoyed this podcast, please share it with your friends. We appreciate each and every one of you. We cannot do what we do without you. Also, please don't forget to write a review for us on iTunes or Google Play. Your review will help other doctors and practice owners find us. Till we meet again, wishing all of you an amazing week ahead.